Okay.
Excuse me.
Yes.
May I ask a question in this time that we're waiting for
Sure, yeah.
somebody else?
Is Nikki?
Yeah,
Yes. Welcome, Nikki.
thank you. I want to know, this organization, I mean, Lifestyle Medicine, is founded in US or Canada?
The one that's hosting this program?
No, the Lifestyle Medicine.
Um, you mean the American College of Lifestyle Medicine?
Yeah,
Well, that's American.
Let me answer that in part because you're looking at Dr. John Kelly,
that's
and
right.
one of our main speakers, who is the founding president of the American College of Lifestyle Medicine, which was founded in the United States and actually Southern California at Loma Linda University. But it's become an international organization as a parent to many other lifestyle medicine societies and colleges around the world. And so we struggled mightily hard there for the first 5 years, but now it is a resounding success and a very effective academic and basically society for health professionals who are interested in lifestyle medicine. But it's U.S. based, but its tentacles have spread out through the entire world.
Okay,
Yes,
thank you.
yes. Yeah, let me just share. So the Lifestyle Medicine Global Alliance is the part of the American College of Lifestyle Medicine that reaches to sister organizations around the world, as Dr. Youngberg was saying. And the other thing I would say is the American Board of Lifestyle Medicine certifies physicians and also has an international board of lifestyle medicine to certify them internationally. So.
Thank you. But it's just a non-for-profit organization. I mean, all of the global branches are non-for-profit, or no?
Yeah, yes. Let me just say this. That's actually a very good question, and it's deeper maybe than it seems. So the American College of Lifestyle Medicine has taken careful steps to make sure that the lifestyle medicine associations that we associate with and link up with are peer governed professional societies and not a private enterprise. And I'm sure that I know there are some people that have started their own private thing, but the American College of Lifestyle Medicine and the International Board of Lifestyle Medicine do not associate or recognize them. Okay, so anyway, so the short answer to your question is that it's all nonprofit in the sense that it's a professional organization. It's not privately owned or private enterprise.
Okay, thank you so much.
All right. We are going to get started. So first, my name is George, and I'm with Lifestyle is Medicine, the organization that's hosting this program. And I want to just thank every one of you for joining today. Before we begin, just a few things. First, this is being recorded. So if you do not want to be recorded anyway or identified, please mute yourself. I believe that everyone is already automatically muted. So please do that, and just be aware of your video screen as well. Yes, again, please mute yourself, mute your mic, okay? Also, questions are going to be taken at the end. So we're not going to take questions during the program. So if you have a question, please look in the chat box and type your question there, and we'll get to it at the end of the program. This program is put on by several organizations: Pathways to Wholeness Lifestyle Medicine Center, and also Lifestyle is Medicine. Pathways to Wholeness is a group of lifestyle clinics in Toronto. Lifestyle is Medicine is a non-for-profit that puts on lifestyle medicine programming in the Toronto area. Also, this program is sponsored by the Downsview Seventh-day Adventist Church. They're a church located in the North York area of Toronto, and Seventh-day Adventists have a long tradition of promoting healthy lifestyle behaviors. All right. So today, our
I'm sorry.
yes.
I'm sorry. We're now joining from the other room. So would you hold a while, please? We were in the wrong room and we've just got this connection. So there are lots of other people joining. If you don't mind holding for 60 seconds.
I see. Okay, we'll hold for 60 seconds.
Thank you.
Okay. So I'll start. I'll pick off where I left off. So for those of you who just joined us, I want to thank you for joining the program today, for taking your time to join us. I hope that the conversation today will be stimulating and informative. Today, our topic is going to be type 2 diabetes, a very important discussion. We all know that diabetes is going up and up, but we believe that through lifestyle practices that this disease can be addressed effectively. Today, we have two speakers who are well qualified to speak on this topic, and I'm going to introduce them to you at this time. First, we have Dr. John Kelly. Dr. John Kelly is a physician and founding president of the American College of Lifestyle Medicine. He is also an assistant research professor in the nutrition department at Loma Linda University. He was a principal investigator for a multi-million-dollar diabetes research project in the Marshall Islands and continues to do research in lifestyle interventions for diabetes. He's also the director of Oak Haven Lifestyle Center in Michigan. The other presenter today is Dr. Wes Youngberg. He has a doctorate degree in public health. He is a clinical professor for both the Department of Preventive Medicine at Loma Linda University School of Medicine, and also Loma Linda University Department of Public Health. He's also founding director of the American College of Lifestyle Medicine. Dr. Youngberg spent 14 years in Guam researching diabetes and has written a book on diabetes titled Goodbye Diabetes. He has developed an online diabetes program called Diabetes Undone, and you see that on the screen there. So Dr. Kelly and Dr. Youngberg, welcome to Lifestyle Medicine Live.
Thank you, Dr. Cho. It's good to be with you. And I think this is indeed a very, very important topic. And I'm really pleased to be with Wes, my friend, Dr. Youngberg.
Yes.
Likewise, Dr. Kelly and I go way back Loma Linda days, but as well as on the Marshall Islands. So we're looking forward to being on this webinar with you today, Dr. Cho.
Great. You know, Dr. Youngberg, just to break the ice a little bit, you know, you don't know this, but when I was an intern at naturopathic college, I'll actually use your book to help me guide my treat my patients with type 2 diabetes. So it's great to kind of speak with the author of that book. So thank you.
I'm honored.
Well, you know, before we get to the main discussion on diabetes, I just want you both of you to comment right now, just kind of bring it a little bit closer to home. Right now, we know that there's obviously COVID-19 happening, a SARS-CoV-2 virus, but diabetes actually has a big role to play in that, right? We don't want to get too deep into the weeds of that, but just can you comment on that? Because people might not be so aware of the research that's coming out linking diabetes and COVID-19.
Yeah, there's a tremendous amount of research. In fact, all along, the big concern has been that the only the people who are having problems with COVID-19, if they're infected, are the ones that have underlying medical complications like diabetes in particular. That's one of the first ones that you hear about. It can be asthma, it can be hypertension, it can be heart disease, or diabetes. And in fact, many emergency room physicians are reporting that their patients respond very well to many of the strategies that are introduced there in the ICU units, But if they're diabetic, they're the ones that are amongst the highest risk to go on to develop serious complications requiring ventilator support. And between 50 and 80% of people who go on a ventilator don't come out of the hospital alive. So my passion has been over the last 3 months is to educating diabetic individuals that if there was ever a time to really focus on the natural and lifestyle medicine strategies that help reverse the underlying triggers or causes of diabetes, this is the time, because you have the most to gain and the most to lose if you do not follow this protocol. So what Dr. Kelly and I will be sharing with you is the good news that diabetes can be undone, that we literally can say goodbye to diabetes much of the time. And even if we don't, even if you do all the strategies that are well documented in medical literature that help many people reverse their diabetes, just by simply following those strategies, even if you may remain a diabetic, you are dramatically lowering your risk of complications because of COVID-19, because treating the underlying causes of diabetes are also treating the underlying factors that drive somebody's immune system to depression that then allows the body to succumb to the virus. Otherwise, the vast majority of people have an immune system that is capable of being victorious over this virus. So we want everybody to be victorious, including our diabetic population.
And Dr. Cho, just to cite one statistic, just 2 or 3 days ago, there was an article in the Journal of the American Medical Association looking at the results in 5,700 patients from New York City, and they risk those who actually needed to go on the ventilator had almost twice the likelihood of having diabetes as the ones that did not. So that just completely verifies what Dr. Youngberg was just saying.
It's amazing how one chronic disease can affect an acute disease. Well, let's go right into diabetes then. And this, Dr. Kelly, I'll direct the first question to you. So many people know that type 2 diabetes is when your blood sugar is high, but many people do not know why it's high. They're not told the underlying pathology. Can you explain what exactly is type 2 diabetes and what is the root cause? So like, why is the blood sugar going up?
Yeah, this is a fantastic question. It is true. A lot of people don't understand. Even people that have diabetes sometimes do not understand. So I would have to say, first off, no, I cannot explain exactly, because I don't think that we know exactly yet. But what we do know is this. We know that what the problem is not sugar. We call it diabetes or sugar diabetes in my part of the country. But it's not sugar that causes diabetes. It's actually excess calories, and the chronic excess calories lead to storage of energy in the form of adipose tissue. And when this excess calories build up, then it leads to lipotoxicity throughout the body, causing insulin resistance, causing problems in the liver and gluconeogenesis in the pancreas. And so this is becoming more and more widely known. I would want to say this, that I mean, right now, Dr. Youngberg and myself and others are working on a course for the American College of Lifestyle Medicine, reversing insulin resistance and diabetes with lifestyle. And so that we've been doing a lot of recent research of the literature. And I can tell you that I can see studies, and over the last 10 years, there's more and more recognition of what I'm saying. But 10 years ago or 20 years ago, it was thought that the cause was genetic, that it was strictly, it's in your genes and you couldn't do anything about it. All you could do is thank God for insulin. Well, it turns out insulin is maybe great for type 1 diabetes, but it's in many ways, it's a curse for type 2. So to answer the question about what is diabetes, what's going on is chronically excess caloric intake leads to hyper storage of adipose, which then invades other tissues. We're talking, normally you want to store your calories in adipose cells, but when they start being stored in the liver cells and in the pancreatic cells and in the muscle cells, things start to go awry, and the body produces more and more insulin to try and keep the blood sugars down into the normal range. And eventually that cannot happen, and the blood sugar starts to rise. And that's when we say we have prediabetes or diabetes. But in reality, as you're going to learn through the rest of this seminar, this is a process that started way before your blood sugar went up. And the solution is not managing your carbohydrates or managing your sugar intake. That only controls the symptoms. If you really want to fix this disease, you have to go to the chronic excess caloric intake. So that's my short answer.
Dr. John, you mentioned the word lipotoxicity. Can you distill that down in very easy language for us?
Thank you. Yes, yes. So what we're talking about is when our cells in the body are forced by this high insulin level to take up glucose that they really they're not using. They don't need that glucose for their normal level of function. Then they actually store this in the form of lipid or fat in the cell. And we call this lipotoxicity because lipo meaning fat. This is harmful to that cell's functioning. And so that's what we mean by lipotoxicity.
Dr. West, fat and cells and diabetes, not too many people make that connection. They always think it's sugar and insulin.
Well, it's a combination, as Dr. Kelly just said, it's excess calories. And so the number one cause of excess calories is too much refined carbohydrate. The number two, or close to it, would be excess fat, especially of the animal fat variety or the free oil variety. That is just unnecessary in our diet and just simply adds excessively to our caloric load, which the body metabolically can't handle. So that's why when I'm working for the first time with a new diabetic or somebody who's struggled with their diabetes over years and decades, is I essentially say two things. Number one, the reason your blood sugars are high is because your metabolism is depressed. We need to figure out what all the triggers are that are contributing to that depressed metabolism. In medicine, we call it metabolic syndrome or insulin resistance syndrome. And so we help educate them about how to reverse insulin resistance, which is the cells of the muscles throughout the body and the cells of the liver specifically not wanting to let sugar into the cell so the blood sugar goes high. And that can be quickly remedied within days and sometimes within meals if we're eating the right foods. And then I always say on a practical note, if we can get individuals to do light, so we balance their meals and eat the right foods, right? The whole plant-based diet is the goal. And then the second goal is get them exercising lightly after every meal, because that clearly brings down the after meal blood sugars, which is by far the most important blood sugar for the diabetics, because that has the biggest impact on the caramelization effect, the glazing effect of sugar to proteins throughout their whole body and bloodstream. And so if we can get them exercising a little bit, not get sweaty, just go walking or do some light activity immediately after eating, that'll lower the after meal blood sugar by anywhere from 1 to 3 points for every minute that they do light exercise. And that can have a powerful shift on their blood sugars. Most people never check their blood sugars after meals. They always check before the meal. So how are you going to know the impact of your meal if you don't check your blood sugars after the meal, right? And so that's what gets people into this focusing on how my body responds to the choices that I make. And we see great success once people start doing that.
Dr. West, then, Dr. Kelly talked about excess calories and so forth and building up of fat. So the next question is, so is type 2 diabetes mainly genetic? Because a lot of people say, my mom and dad had diabetes, and therefore here I am, I have diabetes. Your comment? How much does genetics play into this?
Well, genetics always plays a role. If it wasn't genetic, it wouldn't happen, right? So genes have a lot to do with our health, but they're not the primary reason we develop the problem. Genes open the window, Okay, but we can choose whether we jump out the window or not. Okay, so the researchers have been clear over the decades. We've known that easily 70% of the world's population have at least some major gene mutations associated with diabetes. Okay, but that should never be an excuse, as Dr. Kelly pointed out, to say, well, you know, mom had it, dad had it, you know, my aunt had her leg amputated, my uncle went blind. It's just in the cards for me, right? It's just something that's going to happen eventually. And so, you know, que sera, sera, whatever will be, will be. Of course, that's precisely a fatalistic viewpoint that will get us into trouble. The reality is that we can change the expression of those genes favorably. We call that epigenetics. And the influence of things outside of genetics on how those genes operate, how we turn those on or off, is dictated by the choices that we make with our diet, with exercise, with sleep habits, with our environmental exposures. And so that's why lifestyle is medicine. It's the most important medicine of all.
Yeah, and I always like to tell folks, you know, we don't only inherit our genes from our parents, we inherit cookbooks. And so it's a fact that actually we're now realizing that type 2 diabetes is more epigenetic than it is genetic. So it's really more about our lifestyle affecting the gene switches than it is about the genes themselves.
Then I have another question for both of you. And, you know, I was looking at the 2018 diabetes clinical guidelines for Canada. And if you look through the whole document, they mention nothing about reversal. The word that they use is management. But both of you, I mean, Dr. Wes, I read your book, and clearly you believe that diabetes can, in some way or shape or form, be reversed. At least there's a possibility of that. And I know that Dr. Kelly, you and the American College of Lifestyle Medicine does believe that type 2 diabetes is potentially reversible. So who should we believe? What does the science say? Because these folks who are making the guidelines, clinical guidelines, are saying they don't use the word reversal, but you're saying that potentially it is. So can you explain?
I say we're all right, Dr. Cho. We're all right. And so it was Henry Ford who said, whether you think you're right or you think you're wrong, whether you think you can or you think you can't, you're right, he said. And so the reason why many people don't believe that diabetes is reversible is because they themselves have never seen it, because they have never actually researched or figured out how to do it. And so the average physician, especially somebody trained years ago, who had no exposure to even the thought, the consideration that diabetes may be reversible, they never implemented a clinical protocol or strategy that would even come close to helping their patient reverse their diabetes. And therefore, it's impossible. And under those circumstances, it's impossible. And that's what we still see broadly in the medical world, is that people don't believe it's possible because they are not privy to understanding the underlying triggers. So that's why as we began this discussion, we need to understand what drives it in the first place. Once we do that, the vast majority of people, especially if caught early in the disease process before the pancreas has lost the vast majority of its ability to produce insulin, that is a condition where we can reverse it. Let me give you a quick example, you know, because somebody would say, well, maybe somebody who's fairly young, maybe they can reverse their diabetes, maybe for a year, but after that, it comes back, right? Well, anything can come back if we do not continue to follow the strategies that allowed us to reverse it in the first place. So I had 6 years ago, I had an 89-year-old patient who wanted to address his diabetes. He had blood sugars well above 300, and Dr. Cho, you can tell your Canadian friends what that means in terms of world units versus U.S. units. But he, you know, very, very high blood sugars, way too high, about two to three times too high after meals. And And so, he was under the impression that there's nothing that could be done about it. Well, as he worked with me, he learned, he was a very successful businessman. And so he just said, tell me what to do and I'll do it. And we just had one session. I told him what to do. He started implementing all the strategies. And Dr. Cho, within 5 weeks, he calls me up and he says, Dr. Youngberg says, I want to get tested again. It's only been 5 weeks. I said, well, he said, yeah, but it's going to be my 90th birthday and I want to be able to tell them where I'm at in my goals to reverse diabetes. We tested him and his hemoglobin A1C had dropped from 7.2, which is clearly diabetic, to 6.2, which is clearly not diabetic based on that guideline. And that was 5 weeks. Again, that was based on his diet change and his exercising after meals, and he stopped snacking in the evenings. Then what happened is that he kept this up, and after 3 months, he wasn't even pre-diabetic anymore. And after 6 months, his A1C went down to 5.1% and has stayed there. He's 96 years old now. So nobody can make the excuse that I'm too old, okay? It's just a question, are you willing to get on the program, to follow the recommendations, and you will get dramatic results if you do.
Dr. Cho, if I might share a thought, I appreciate the question, and there are people who genuinely are concerned that those of us who say you can reverse this disease when the so-called recognized experts say you cannot. So let me just speak very plainly and clearly to that, because I appreciate Dr. Youngberg's case example. But the reality is what happened is in the 80s, we started using bariatric surgery to treat morbid obesity. And lo and behold, one of the side effects was people with type 2 diabetes were being cured, or their diabetes was going away. And that fact really is what made us change. And so in 2009, the American Diabetes Association is the first time they published a consensus statement on what is remission. What is, they had to define it because it's happening. And so we've kind of been forced into this, but now, many organizations are realizing that it is possible to do this without surgery. In fact, amazing study done by Youngberg. I can give you the citation, but they did this study where they actually asked the question, is the diabetes remission due to the surgery or to the diet? And they did a crossover study where they had people that were going to get the surgery were randomly assigned to go on the diet for a couple of weeks before the surgery, or to get the surgery and go on the diet for the 2 weeks. And what they found was, believe it or not, and this was a Roux-en-Y, this is one of the very aggressive bariatric surgeries, the people who went on the diet without the surgery actually did better, had better remission than the ones who had the surgery before they went on the restrictive diet. So diet alone can reverse diabetes. Unequivocal, absolutely.
Absolutely, yes.
Well, you both mentioned nutrition, so we're going to start getting a little bit deeper into that. And we'll go to some of the specific controversies that are out there, or the misconceptions out there that people have. So first thing, for you, Dr. Wes, there's a lot of discussion about ketogenic diet. Paleo is kind of a modified ketogenic diet, if you will. High carb, low carb. Some people say, carbohydrates aren't good. I shouldn't eat rice. Can you comment on the low carb, high carb, low fat, high fat controversy there?
Okay. Well, first of all, Dr. Kelly and I both had the privilege to work with Brenda Davis, a registered dietitian who's Canadian. And in my opinion, she's the most respected, from my perspective, the most respected dietitian in the world relative to diabetes management. And
yes,
and she of course was involved with the Diabetes Undone project. But we first met in Dr. Kelly's research project in the Marshall Islands, where he was medical director of this big project that was working with some of the sickest of the sick. These are diabetics that were, had amputation risk, they had blindness risk. I mean, these were hardcore diabetics. And so he took this message of addressing diabetes management using lifestyle medicine to the Western Pacific. And that's how we met Brenda Davis specifically. Well, the challenge is sometimes the way the question is posed creates a more of the controversy. And so in my opinion, it's not so much about the amount of carbohydrate or the amount of fat as it is the type of carbohydrate and the type of fat. And so that's why the emphasis from a clinical standpoint should be on a whole plant-based diet. So it should be plant strong, meaning the majority of the calories or the volume of the meal planning comes from whole plants, and ideally 100% from whole plants, because that's where you get the nutrition. How do you heal any chronic lifestyle related disease? Is by number one, dramatically increasing the amount of nutrients, not calories, clearly, but nutrients. And the way you get more nutrients is by eating foods that are high in nutrients, and those are the whole plant-based foods. Those are the non-starchy vegetables first and foremost, the green leafy vegetables and the colorful vegetables. And so those are carbohydrates. So to say that carbs are bad or you can eat all the carbs you want is really the wrong way to pose the question, I believe. I think the right way is to help educate people to eat the right type of carbohydrates, where every morning I eat a big carbohydrate breakfast, but it's primarily non-starchy carbohydrates. And I never would have thought that I would be eating stir-fried vegetables for breakfast, guys. But that's my favorite part of any meal of the entire day, where I get a big bowl, 3 to 4 cups of stir-fried purple cabbage and mushrooms and onions and baby spinach and a couple slices of avocado on top of that. That's good stuff. That is tasty and it's full of fiber, but more importantly, it's rich in nutrients. So you have a high nutrient to calorie ratio. Okay, and then here's the key. How do you determine what other forms of carbohydrates, the more starchy carbohydrates, we include with our meals, any meal? And that's to be determined in large part, for a diabetic at least, by looking at the after meal blood sugar. So if you check your blood sugar an hour or maybe 2 hours after the beginning of your meal, that tells you what your tolerance is for regular starchy carbohydrates or fruits. That should be the determining factor more than following one plan for all.
So thank you, Dr. Youngberg. Can I make a comment, Dr. Cho?
Sure,
So
yes.
what I say when people ask me about the ketogenic diet is, number one, excuse me, the statistics show that the majority of the people who say they're on a ketogenic diet are actually not in ketosis. They're not eating in a way that is literally keeping them in ketosis.
Right.
So that's the first thing, and they don't even realize that, because the fad diets, people don't really know that. Second thing is that there are companies that are actually doing this, and they're keeping people in ketosis, and they're seeming to get some good results. In fact, Hall and some of the others have published papers showing some apparently good results with a ketogenic diet that maintains ketosis. However, there was a review in the journal Nutrients just recently, where they looked, the experts panel, it was like 12 or 15 people, they looked at this question and they looked carefully at the literature and showed that the fact is the ketogenic diet has not been studied more than 1 year. The longest period of any study has been 1 year. Secondly, there's plenty of measures that tell us that those people who are on a ketogenic diet still have insulin resistance. Yes, it's helping apparently to control their blood sugar or keep their glucose down, but it is not actually fixing the underlying problem. And so many of us who are trying to find the best answer are aware of the fact that this is simply not, right now, it's not the right way to go. I'm not saying that it may not be workable in the future, but it's not the way to go. However, having said that, as a clinician, if I encounter a patient that is controlling their weight and blood sugar with ketogenic diet, I do not, tell them, oh my goodness, this is the end of the world, you got to change. I say, well, let's see how this goes for you, because for most people, it is not a long-term solution that you're happy with, and most of them find out that it works better in the short term and not so well in the longer term.
In my experience, I mean, they start to feel bad, like they start feeling unwell after being a while on the ketogenic diet. So
that's true.
Let me also add that, first of all, well, I loved Brenda Davis's lectures on this very topic, because she points out that there's actually a lot more in common between a properly done ketogenic diet and what we refer to as a whole plant-based diet. A properly done ketogenic diet actually encourages more of the non-starchy vegetables, etc. Now, an improperly done ketogenic diet, which is unfortunately the way most people do a ketogenic diet, where they're saying, I hear it all the time from some of my colleagues who promote a ketogenic diet. They say, well, you can't be on a ketogenic diet unless you eat meat. And I'm going like, no, that's not true, because I understand the potential value of it, but I also understand the great risk that is taken when somebody buys into the perspective that you have to eat meats, animal protein, to be on a, quote, healthy ketogenic diet. And my problem with the ketogenic diet, as done by most people, is primarily the damage that it does to your kidneys. I've had many patients that went to esteemed institutions in the United States and saw well-known physicians who were promoting a ketogenic diet and that blew out their kidneys, which is layman's term for causing an aggressive advancement of chronic kidney disease to the point where they were very close to requiring kidney dialysis. And then they came to me and I nurtured them back to healthier chronic kidney function, literally reversing the stages of chronic kidney disease. And we did that by going on 100% whole plant-based diet. Now, I am not one that insists that all my patients eat 100% whole plant-based diet. I do that. I recommend that, but I'm not going to insist that you have to do that or you can't be my patient. I'm helping lead people in a direction to make better lifestyle choices for themselves. But when I get a patient that comes to me, Dr. Cho, who has advanced chronic kidney disease, or basically is coming to me because they're being told that the doctor, the nephrologist, wants to put a port in them and wants to get them ready for kidney dialysis, and now finally they're starting to think about their health and what they can do to prevent that eventuality. Well, that's a far in the continuum of advanced disease of the kidneys. Okay, but even then, I've had patients who came to me with a glomerular filtration rate of 21, okay, which is getting very dangerously close to stage 5 chronic kidney disease, where the doctors are already preparing him for kidney dialysis. And now a year and a half later, that same patient has a kidney filtration rate of 89, which is better than a lot of college students I know. So in other words, the kidneys can regenerate. We can heal if we remove, number one, the toxic influence of animal-based proteins. And so to me, that's a bigger issue than the fats or the carbohydrates. Okay, that's animal protein is really bad for the kidneys. And we know that, in fact, the president of the National Kidney Foundation in the US spoke several years ago at a national conference and said the best thing she knows of for these individuals is to put them on a plant-based diet, and it dramatically slows progression. Okay, and if we do other things at the same time, in other words, if we take a more broad perspective to lifestyle medicine and natural medicine, we're able to actually help reverse the condition in many people, especially if they're starting at stage 3A or stage 3B chronic kidney disease. So that would be my main argument against the typical ketogenic diet, is that you're much better off going away from animal-based proteins and just getting healthy plant-based proteins, which are not damaging to your kidneys.
Great. All right. Let's get more specific into the nutrition, and we're a little bit tight on time, so maybe have one person each for each question. So a common question that people have is fruits. So Dr. Kelly, can people with type 2 diabetes have fruit? Just very quickly.
Yeah, sure. Well, the answer is that this question itself is problematic, because if you have type 2 diabetes that you are not treating with lifestyle, you definitely want to avoid some foods like fruit, that if you are actually, however, treating your diabetes with a healthy lifestyle, fruit in general is not a problem. So what I would say to answer this question is that yes, when I'm treating a patient with lifestyle change that has type 2 diabetes, I use fruit as part of their food. However, if I'm talking to a person that is a conventional, typical patient, then yes, I acknowledge to them that fruits can be a problem with your blood sugar. So anyway, the answer is, if you are on a healthy lifestyle and you're reversing your diabetes, fruits can be a part of your diet.
Dr. West, how about dairy?
You know, from a clinical standpoint, one of the first things that I encourage my patients to stay away from, if they're coming to me for pretty much any health issue, is to get off of dairy. I even tell them to do that before I start talking to them about getting off of meats. And the reason for that is because dairy products are such a big factor in creating allergies and creating autoimmune issues with digestion, leading, you know, if you're not digesting food very well, that means you're not assimilating nutrients very well. And if you're not getting your nutrients, you're not healing very well. So it sets you up for immune depression, for all kinds of health problems. So I strongly discourage the use of dairy, even from a clinical standpoint, even above other things.
And in fact, cheese is the worst form of dairy. That's all.
Agreed.
We're short on time. I won't go into that more, but that's.
Dr. Kelly, this one's for you. So you talked about excess calories and weight gain and so forth. So a lot of people say, you know, nuts and seeds, they have a lot of calories, nuts make you fat, so forth. Are nuts okay? What are your guidelines? What are your thoughts on nuts and seeds?
Well, when it comes to type 2 diabetes, I do not find whole nuts to be a problem. I do know, of course, and respect Dr. Caldwell Esselstyn, who is one of the more prominent clinicians that restricts nut intake for very severe heart disease patients. But in my own experience and studies that I'm aware of, the fact is that whole nuts, especially whole raw nuts, are helpful, not harmful. And so I do not encourage people to avoid nuts at all, but to take them in moderation.
Agreed.
Dr. West, there's a lot of, it's kind of a fad now, but you know, like intermittent fasting, time restricted fasting, meal timing and all this. When someone has type 2 diabetes, is there certain times of the day that they should be eating, or does it matter? What are your thoughts on intermittent fasting, time restricted fasting?
Yeah, great question. I'm actually a big fan of this. And I tell my patients that the challenge has to do with what medicines they're currently taking. And our goal is to get to the point where we're adjusting the medicines to the lifestyle, not adjusting the lifestyle to the medicine, which is going to get you into all kinds of trouble. But as you initiate that approach where you're adjusting your medicines to your new, healthier lifestyle, you have to work with your prescribing physician and let them know that what you're doing so that they can start adjusting your medicines immediately. Because if you're on insulin, or if you're on the medications that increase the production of insulin and you're produced by your pancreas, and you start exercising after meals, and you start doing other forms of exercise to get fitter, and you start eating a healthier diet and getting a lot of nutrients, all of a sudden your body's ability to control blood sugars improves dramatically, and now you're over medicated. And so one of the worst things that can happen is that you end up in the emergency room because your blood sugars have crashed because you're on a healthy lifestyle program. But the reality is that that happened because you did not adjust your medicines accordingly. So that's a very important caveat that we always say at the beginning of any diabetic management program, is that you have to be checking your blood sugars regularly before and preferably 2 hours after meals. The first week or two, I would do it before and 2 hours after every meal, so that you get a feeling for what's going on, and you can quickly then adjust your medications according to a schedule that your doctor has given you, knowing that you're going to be doing it. I basically tell your doctor, if I were to go on an intermittent fast or any form of fast, how would you restrict my medicine intake? And then follow that. We would rather your blood sugar to run too high for a period of time than run too low. Too low is far more dangerous than too high, especially in the short term.
Right. And can you describe intermittent fasting, like the time frames of intermittent?
So basically, eating a good breakfast, and then 5 hours later or so, a good lunch. And then if you want to have a more rapid weight loss or reversal of insulin resistance, which is the main underlying driver of diabetes, then you just skip the evening meal. Now that's too dramatic for you. You eat a very light evening meal, and then you have nothing to eat later than that early evening meal, so that you have at least 12 or 14 hours of no calories between an early evening meal and your next breakfast. And so if you're doing a 12+ hour intermittent fast, that gives your body a chance to get used to burning its own fat stores. As Dr. Kelly pointed out, that's when you can get rid of some of that lipotoxicity associated with unnaturally high levels of fat built up in parts of your organs that damage the ability of the body to do what it's designed to do.
Yeah, and I would just add to that that intermittent fasting can be done by fasting one day a week. Excuse me. But I do like the plan that Dr. Youngberg just mentioned, which is actually, if you look in the research, it's called early time-restricted feeding. This idea of intermittent fasting in each day is called time-restricted feeding. Anyway, I know we're short on time, and there's so much
for
that could be said.
diabetics, you wouldn't want to do a full day of fasting, because then that really messes up unless they're not on any meds.
Correct.
If on medicines, you're better off setting a time-restricted eating option of that, which most people still refer to as intermittent fasting, even though technically.
No, thank you for explaining that. That's true.
Yeah.
I should definitely. It can be harmful if you're on insulin or whatever, and you have nothing to eat all day. That's a problem.
All right. Last few questions here, Dr. John. There's a lot of questions about, like, are there specific plant foods that people should be eating or not? Because you both talk about generally whole foods, plant-based. So we know that means plant foods that are generally less processed. But even amongst fruits and vegetables, like, do you recommend like lower glycemic index? Like, are bananas okay? You know, people ask these types of questions. What are your thoughts?
Sure. No, those are good questions. And actually, I don't think we're going to be. I mean, there's individualized aspects to this. So I want to say that right off. If I were a physician, I would certainly want to talk to the patient before answering the specific question for them. But overall, in general, diabetics have been taught to be way too afraid of food. It's not the food. But when I have had diabetics that are the most difficult to control, like Dr. Youngberg was saying, that maybe their pancreas has gotten weak and they can't produce as much endogenous insulin, etc. But I have patients all the time that say, but I will do whatever it takes to get off of medicine. And if they really are honest, then with that, I put them on the intermittent fasting he was talking about. So we're skipping suppers. And what I use for meals is what I've come to call leaf, stem, and flower. Okay, so we're going to give them veggies instead of fruits, for the majority of their diet. And we're going to give it to them like cruciferous vegetables, the leaf, stem, and fruit. So we're going to have the broccoli. We're going to have cauliflower. We're going to have greens like kale and other kinds of things. and cooked or raw is fine, and with some flavoring. But the bottom, where I'm headed is, this is only during this period of time that we're getting their metabolism back to more normal. You do not have to eat like that for the rest of your life. You just have to, it's a therapeutic diet. And I have all the time people that start this way, they get their sugars under control, they get off their medicines, and then they start to eat a more normal whole food plant diet.
Okay, good. So, great. You know, Dr. Wes Youngberg, I want to show you something here. This is the Canadian Food Guide that's just released. As you can see, it's pretty good, but they still recommend kind of moderate use of animal foods. So what if someone says to you, you know, everything in moderation, just very quickly, could you comment on that? Just everything in moderation, why have to go quote unquote extreme?
Well, you know, it's remember, food is politics, right? So it's been said that it's easier to change somebody's religion than it is to change their diet. And so in any organization, whether it's a nonprofit organization or a government organization or a government itself, there's always politics, and you're never going to get a recommendation that is not watered down in terms of the science. There's always going to be compromise from any recommendation or any consensus development statement. And so that's why I choose to listen to the experts that I trust more so than organizations, because you're always going to get a watered down kind of a mediocre approach when you listen to organizations. But speaking to your question directly, there's Dr. Walter Willett, who is one of the most respected nutritional epidemiologists ever from Harvard University, said it best when he says, you know, there's definitely some foods we should avoid completely, and there's definitely some foods that should be taken on a regular basis, and there's many other foods that are maybe what we call yellow light foods or secondary, second class foods. And so in our programs and in the book Goodbye Diabetes, we outline the green light foods, which means have at it, enjoy it, eat as much as you want of those. And then the yellow light foods are, you got to be a little bit more cautious. Those are okay to incorporate, but you have to, those are the foods that you eat in moderation. And then the red light foods are the ones that, no, you stop, you just completely avoid those. So also known as first, second, third class foods. So do you want to have first class health, or do you want to have third class health? So it's, these are really our choices. I never force anything on anybody, because I believe that each person is the chairman or the chairwoman of their own health. Nobody else should have control over what we do for our health. No one. Okay, that's our decision, but we need to accept the consequences of our choices, and not force other people to pay for those consequences, right? Because it's on us. So when people say it's too hard, like we see on the screen, okay, it's too hard to change my diet. Well, yeah, nothing is easy, right? But is that harder than going through the complications of COVID-19? Is that harder than having a heart attack or a stroke? Is that harder than having your leg amputated? Is it harder than going blind or having all the complications associated with diabetes? Absolutely not. It's relatively easy to do this if, where there's a will, there's a way. And so I just encourage everybody listening to say, no, it's not too hard. Okay. It's a willingness to put ourselves out there and make choices and learn about how to do this. And so I applaud you, Dr. Cho, and your organization there in Toronto, and for fellow Canadians and people all over the world watching, that this information is doable. It's not too hard, okay? Especially if you decide it's not going to get you down.
Great. And for those who are wondering why he brought up COVID-19 at the start, we talked about how they're finding that those who have diabetes and hypertension and other chronic diseases have a greater risk of getting severe forms or severe illness from COVID-19. And just to comment, I guess everyone draws a line somewhere, right? No one actually believes in everything in moderation. Dr. Kelly, just one last question before we close off here. There's a question about juicing. Do you think juicing is good? How much? When? What's your thoughts? Very quickly.
Yes. That's a really great question. And bottom line is, keep in mind that juicing usually refers to a refined product. You take a whole food and you put it through a juicer, and you end up with pulp on one, comes out one place, and juice another place. We call it a smoothie if it's got everything, the whole thing. So I don't actually recommend juicing or juices. I recommend the entire food. So smoothie would be a more appropriate way to do this. I have definitely found that you can make green smoothies, and they can be a very effective way to help you change your diet. So if that's something that someone likes and they make them in such a way that it's a whole food, yes, I think it works well, can work well.
Great, thank you. And just to close off, so Dr. Wes already addressed the question on the screen. Dr. Kelly, you're also a clinician. You're not just a researcher. You've seen many, many patients. Someone's listening to this saying, whole foods, plant-based, cutting out meat, dairy. This sounds really too hard. I'm pretty sure you have had patients who've had this concern. Can you, what would you say to that? Someone's listening to this saying, this sounds really hard.
Well, Wes, let me, I'm going to be brief. Let me go first, and then you can finish.
Oh, I already did it. Go for it.
But anyway, I just want to say that I have, of course, we have this all the time. And I work with, there are people who say, Dr. John, I've tried this before. I've tried many times, and it just won't work. And so I spend time with them trying to encourage them. Will you give this a trial? Will you give me 2 weeks? If you give me 2 weeks, then evaluate. Is this going to work for me or not? And so what I do then is I help them to see that, number one, what they're doing with their lifestyle change is changing the switches on their genes. We can literally change one cell into another cell, as I'm sure you know, Dr. Cho and Dr. Youngberg, maybe not all of our audience, but we now are able to take a fibroblast and change the gene switches and turn it into a functioning heart cell. It's been done in mice. That's how powerful, I'm telling you this because that's how powerful changing switches is. And the most powerful modulator or change agent for gene switches is diet. I can change more gene switches more rapidly by changing my diet than anything. So why am I talking about this? The person was saying it was hard because when you understand the power of lifestyle, it becomes a lot less of a problem. If you think of it, oh, I'm going to have to fast, I'm going to have to give up this. No, it's not about giving up. It's about actually turning on the switches that will give you good health. And it's a very different way of looking at it. The other thing I say about sounding too hard is I tell them about this study that was published in Diabetologia 2 or 3 years ago. Maybe it was 4 or 5. But anyway, the Taylor Group from the United Kingdom published a study showing that they reversed the triacylglycerols in the liver and in the pancreas within just a matter of a week or two. And the insulin response of the pancreas normalized in 4 weeks. When they then started getting people calling and asking them, can I put myself on this diet? They published a study showing almost 100 people who had put themselves on a very low energy diet to reverse their diabetes. And the interesting thing was this, they asked them about working with their doctor. About 1/3 of them, their doctor worked with them to change their medicines and whatever. 1/3 didn't tell their doctor that they were doing it. And the other third, the doctor told them, oh my goodness, don't do that. So my point is, it may sound too hard. I'm glad that word is in there, sound. It sounds hard, but it's actually very easy. And the studies show that when you see results, when you see the reversal of your disease and you feel better than you ever have, it seems easy to you.
And let me just add to that, if you're checking your blood sugars both before each meal and 2 hours after the beginning of that meal, and you're looking at the impact of the change of diet, start with the first 2 days not changing your diet, see what happens. Most people never know how high their blood sugar goes after a meal.
It's true.
So they see, oh my goodness, my blood sugar is over 300 or 2-3 times higher than it should be. And then they start checking it after they implement the meal changes, the exercise after the meal changes. And all of a sudden now they're convinced because they see the power associated with
Yes.
these relatively simple strategies.
Thank you so much. So thank you, Dr. West and Dr. Kelly, for your input, your insight on nutrition. I know that due to time, we couldn't address other aspects of diabetes care, like exercise and so forth. We'll probably address those in future lectures. Just to remind everyone that you can also follow Dr. West and Dr. Kelly on different platforms. Of course, we had talked about Dr. West's book, Goodbye Diabetes, and he also has a program that's online called Diabetes Undone. I highly recommend it. Also, there's a website called audioverse.org where you can listen to Dr. West and Dr. Kelly's talks if you search on there. I'm pretty sure you're also on YouTube as well. Also, just want to thank the organizations that put this on: Pathways of Wholeness, that's a medicine clinic, Lifestyle is Medicine, and of course, the Downsview Seventh Adventist Church. We want to thank the church so much for sponsoring and supporting this program.
Yes, thank you.
Our upcoming program is this Thursday, and it's with Chuck Carroll. Chuck Carroll had nearly a miraculous weight loss journey. He lost over 200 pounds following lots of the things that we actually talked about today. And so he's going to be coming on to share about his weight loss journey. He's the host of the wildly popular Exam Room podcast. And so we hope that you could all tune in. It's on Facebook, on a website. You can go and register there as well. All right, so thank you, everyone. And again, thank you, Dr. John and Dr. West, for your time. Thank you, everyone, for taking your time on this Sunday to join us. We hope that you learned something. And most importantly, we hope that you've been inspired to practice the things that you learned today. And we hope that you have some measure of success, as we're sure you will. So thank you, everyone, for joining us. We hope you join again next time.
Thanks for having us.
Thanks for having us.
Success, everybody. Good to see you.